Hi everyone, you're welcome to another edition of Talk Child Health with Dr. Q Merita. With me again is my dear husband, who is a specialist in ear, nose, and throat surgery. And we're going to be discussing a very interesting topic. If your child has ever bled from the nose, this is for you. Babe, you're welcome to our latest edition.
Thank you again for inviting me.
All right. So, what exactly is epistaxis and why is it common in children?
Epistaxis, simply put, thank you. It's bleeding from the nose, and it can occur in children, majorly because of their tiny little fingers that can easily bruise or scratch those areas that has these fragile blood vessels in the front part of the nose.
Good, thank you. And what are the most common causes of bleeding from the nose in children?
Commonly, a great percentage, 95% or more, is as a result of trauma to the nose. And by trauma, I mean finger picking or nose picking. Because of their tiny little fingers, they can easily bruise that front part of the nose that has these fragile blood vessels and cause them to bleed. There are other things that could cause nosebleeds in children. Foreign bodies in the nose can cause nosebleeds in children. Dry nose, especially occurring during some season or weather conditions. For example, in the very dry season, because of desiccation, it can cause nose bleeds. Recurrent nose infections, allergies, allergic rhinitis, and sinusitis and rhinitis of the nose can cause nosebleeds. But majorly in children, it's 95% will be from finger picking or trauma to the nose.
All right, thank you. And when a child starts bleeding from the nose, what should their parents do if they are present?
Yes, bleeding can be very frightening, even to the children, and their parents too can become very disturbed. But the first thing I usually advise, because majorly these bleeds are not of any very sinister. Yes, there are sinister causes that could occur in children as a result of systemic problems, but these are very rare in children. The first thing is to remain very calm. For the parent, you should be calm as much as possible to make your child very calm. Okay, because crying will increase blood pressure and the blood supply to the nose and make bleeding even worse. Remain calm. Sit your child straight, slightly leaning forward, not backwards. Slightly leaning forward with the head down and mouth open. Make sure it's not backwards. Make sure that the blood doesn't flow down behind the back of the throat into the stomach because that could cause irritation, vomiting, and worsen the situation. Then there's something we call the pads of the finger. This pad of the index finger and of the thumb should be on the soft part of the nose. Okay, you hold, press down, apply pressure while the mouth is open for as long as 10 minutes. Allow the child to breathe through the nose. Okay, if bleeding persists more than 10 minutes and you cannot control this, even with these measures, you should get immediate medical attention. Okay, sometimes you can put some cold compresses around the bridge of the nose, at the nape of the neck, the cheek. This is just to constrict the fragile blood vessels and prevent bleeding.
Thank you very much. Thank you. All right, so the next question is what are the common mistakes parents make when their child or children are having nosebleed?